Hello everyone, so in this video we are going to do the whiplash injury. So what happens in whiplash injury, there's going to be hyperflexion and hyperextension of the neck. What happens in it, for example, if the car strikes from the front, so the head's gonna go forward and there is going to be hyperflexion of the neck. And when the car strikes from the back, so the head gonna go backward and there's going to be hyperextension of the neck. Okay, so because of the hyperflexion and hyperextension, there is going to be fracture of the neck, and because of the fracture of the neck, there is going to be spinal cord injury. Okay, the vertebra that are going to be fractured in the whiplash injury, they are C4 to C6. Okay, because of the consequences of the whiplash injury, either there is going to be paralysis, or either there is going to be death of the person. That's it. Second is seat belt syndrome. What happens in seat belt syndrome? There, as we know that there are certain stripes of the seat belt. There, the shoulder stripe, the lap stripe, and the head stripe. The head stripe is usually not present, but it can present. Okay, what happens? For example, if someone have the accident, so there is going to because of the shoulder stripe, there is going to be bruises, fractures of the rib, and laceration of the viscera. Um, okay, because of the shoulder stripe, the bruises of the chest, fracture of the ribs, and laceration of the viscera. Because of the lap stripe, there is going to be injury of the pelvic, abdominal organs, and the lumbar spine. Okay, and because of the head stripe, there is going to be bruises on the forehead. That's it. Thank you.